thank you so much for that panel. I am very pleased to follow the panel up with a guest of honor, Lieutenant Governor Peggy Flanagan. If you officially search her official bio, she is listed as a Native American activist and the 50th Lieutenant Governor of Minnesota. And if you instead look at her Twitter, you'll see that she is an Anishinabekwe, a mama, a partner, a child advocate, an organizer, and a beaded earring enthusiast. So you may not have heard, but one of the gifts that was passed out to our panelists were beaded earrings. And without further ado, I welcome Lieutenant Governor Peggy Flanagan to the stage.
Thank you very much. Good morning. I was like, oh no, you're going to my Twitter. Well, I was going to get in trouble, but that was good. That's all of that is true. As you can see, beaded earring enthusiast. So what I spent most of the pandemic doing was adding to my collection. Buju, Peggy Flanagan, Indigenous Cause, Giji Wewadum Indigo, Guabaga Ganikagnan Junchaba, Mangan Nodame. My name's Peggy Flanagan. My English name is Peggy Flanagan. My Ojibwe name is Speaks with a Clear and Loud Voice Woman. I'm a member of the White Earth Band of Ojibwe, and my family is the Wolf Clan, and I'm really honored and humbled to be in this space with all of you today. You are doing the work. This work is so incredibly important and powerful, and you can feel it when you walk into this space. Not just because we are literally looking out, like this is a really chill, low-key kind of space up here, but because we are in this space, I feel like we are literally going to the balcony, right? Looking at what is happening around us. And I think the people who do this work are the ones who have the clearest view of how we can make systemic change for our people and for our communities for generations to come. So today, many of you have gathered from various sectors, including healthcare professionals, change makers, researchers, community leaders, students, and advocates, all united by one shared goal: to protect and advance equitable maternal health. It symbolizes the power of collaboration and the strength that lies in collective efforts, because maternal health is a fundamental aspect of any thriving society. And as our sister mentioned, we had those thriving societies before contact. And that we can get back to those ways of how we cared for ourselves and how we care for our communities. It's a cornerstone of well-being for parents and families and for all of us. And I am the proud mom of a 10-year-old Anishinabekwe, who is a skateboarder and a musical theater enthusiast, and really the joy of my whole life. Giving birth to her has been the greatest gift that I've ever been given, and I cherish every moment I have with her, even when she is really demonstrating her emerging leadership skills. You know, as her mother, I remember what it feels like when your body is at its most vulnerable and simultaneously at its most powerful. When you are not just caring for yourself, but also supporting the creation of life. That moment is a sacred time for nourishment and support and for safety. And when you're preparing during those 9 months all the way to labor, you want to know that your child is cared for without having to think about the barriers of our healthcare system. Unfortunately, when I went to the hospital and I was in the birthing room and I brought my photos and I brought my artwork, the visualization of generations of my ancestors standing around me as I did this most powerful act, and I had our traditional medicines, and the first thing that I heard from the nurse who walked into the room is, "You can't have drugs in here." And I said, well, they're not drugs. I was like, this is our traditional medicines. It's important for those to be here. And I had a high-risk pregnancy. I had preeclampsia, and I needed to go in to be induced, and already was feeling nervous. And then continued to hear comments about what it is that I could and could not do. And I was texting my doula furiously, and I was like, please get here as soon as you can. And at a certain point, I said, you gotta go. And I called the ombudsperson, and I said, you need to be in my room right now. This is the most important thing that I will ever do in my life, and Cheryl is not going to ruin this for me. But at the time, right, I was 31. And I was very assertive in my whole life. And so what happened in that moment is another nurse came in and she's like, I'm glad you said something. Because this has happened over and over and over again. And especially with teen mothers, young women of color, this is something that they saw time and time again. And so I had to go back a week later because my blood pressure still wasn't coming down. And I brought my baby. And I said, as soon as we got in that room, I was like, I don't know where Cheryl is, but she cannot be my nurse. But there are people who are also doing incredible work. But we have to speak up when that stuff happens. And we have to feel like we can. And we have to create systems where we can just tell the truth. And I'll be honest, you know, I am speaks with a clear and loud voice woman. But sometimes it's hard. And in those spaces where I was not the most powerful person in that dynamic, I had to make sure that I was, and wouldn't have been able to do that without my doula and without my partner in that moment. So how do we show up for each other in those spaces? And that is what we are talking about today. And so I've had a hard time in the past talking about it. No more. Thank you for creating this space where we can have these conversations. Thank you. So we're fortunate to live in an era where medical advancements and knowledge have allowed us to prevent and manage complications related to pregnancy and childbirth. But we must not overlook the challenges that persist for many of us as we continue to face inadequate access and are disproportionately impacted. Black and Indigenous moms are dying at a much higher rate. The infant mortality rate is 2 times greater among infants born to African American and Black mothers and American Indian mothers than non-Hispanic white mothers in Minnesota. Structural racism has defined our inequities in maternal and infant mortality. And these deaths are preventable, and we must strive to break this cycle for women and for their infants. Every mother, every parent, every child deserves the right to quality health care before, during, and after their pregnancy. And we're working towards that reality right now. Throughout this legislative session, one of our goals was to make Minnesota the best place in the country to raise a family. So we made historic investments in schools and childcare and clean drinking water, housing, paid family and medical leave, which is also all part of this plan, as well as reducing child poverty. So that means starting from birth so that our kids get a healthy start. Pregnant people and families in Minnesota get the support that they need, and every child in Minnesota has a world-class education waiting for them. This also means, among many investments that we've made, we are also focusing on the aspects of health equity to reduce maternal and infant mortality, from funding the continued work of our Office of American Indian Health, establishing a new Office of African American Health and the Office of New Americans, to passing our new Dignity in Pregnancy and Childbirth Act, designed for healthcare professionals to deepen their understanding of the impact of structural racism on health and healthcare of Black and Indigenous birthing people, requiring hospitals and obstetrics care and birth centers to develop or access a continuing education curriculum on anti-racism training and implicit bias, including courses focused on Black birthing people and Indigenous birthing people by the University of Minnesota Center for Anti-Racism Research and Health Equity, in partnership with the Minnesota Department of Health. This is the only one of a few states implementing this type of training. And so we are trying to go as far and as fast as we can in this moment that we have. Because when we say, oh, you need to wait till this next session, or you need to wait till this next month, or you need to wait till this next year, that time span in the life of a pregnant person, right, or in the life of a child is critically important. So today you're going to have, I hope you have a really wonderful experience as you listen to these personal stories, the shared wisdom in these spaces, and join in the remaining workshops. I just ask that you participate in these meaningful discussions with your neighbors to share your expertise, to address the challenges, or contribute for formation of actionable strategies. Just head on. Just go for it. I want all of you to also speak with a clear and loud voice as you are in these spaces. If you feel inspired, let's continue to strive for innovative solutions to bridge the gap in mental health, promote equitable access, and empower others to make informed decisions about their own reproductive health. By investing in maternal health, we have an opportunity to invest in the well-being of our society, in each other, and the future of our country and our nation. So thank you for your dedication and commitment to improving maternal health. Thank you to our health department and Maternal Health Learning and Innovation Center for holding space like this to have an open dialogue, to learn from one another, to create space to lift each other up, and to really push boundaries for what is tangible change. And as Siobhan's mom, I'm really grateful that you're all here, because there are other Siobhan's moms who are afraid and who are scared and who cannot speak up or cannot access that care or cannot drive that distance to get to the support that they need, who do not have transportation, who are scared or who are afraid. And so I am so grateful to this space and to all of you for doing this work, for literally bringing our next generations into this world. Gichi Miigwech, thank you so much, and I hope that you enjoy your time here, and that you just continue to do this good work, and to take care of yourself and to take care of your spirits as you do it. Thank you so much.